necessarily those of this station, its staff, management, or sponsors.
It's Monday night at 9 p.m. and time for Sex Talk with the Siegel Brothers. Dr. Ricky Siegel is a certified sex therapist, educator, and supervisor, and his brother Larry Siegel is a clinical sexologist and certified sexuality educator. The Siegel Brothers are here to answer all your questions about sex and sexuality, but we're unsure who to ask, including questions you didn't even know you had. They will also welcome guests from around the globe to talk about a wide variety of topics and issues within the fascinating world of sexuality. Thank you for joining us, and welcome to Sex Talk.
Good evening, and welcome to Sex Talk with the Siegel Brothers. I'm Larry Siegel, and I'm going to be the only brother here tonight. So it'll be Sex Talk with the Siegel Brother. Thank you for joining us. If you're joining us live on Facebook, hello, glad for you to tune in. If you're joining us on any of our radio stations, thank you for tuning in as well. We can now be heard in addition to 95.3 FM. We are also on 103.9 and 96.9 FM. If anybody is interested in therapy or sex therapy training, certainly would like to give you the number for Modern Sex Therapy Institutes. And Ricky, even though he's not here tonight, the number you can reach him at would be 561-809-1080. And tonight I'm pretty excited. We have some special guests in the studio. I have Dr. Joan Cates and Ricardo Guzman with Simply Men's Health. Welcome. Good evening.
Thank you.
All right. Glad you can come in here and have a talk about something that's really, really common, both in terms of conversation, in terms of things guys don't talk about, and certainly we're hearing more and more about a number of these promising new treatments that we'll talk about in a little bit when it comes to dealing with men and erectile dysfunction. And if you've been watching any television in the last couple of months, you know that the new letters that we are PD. So we're going to do our ED and PD tonight, talking about Peyronie's disease as well as erectile dysfunction. So to start with, Dr. Cates, if you would maybe a little bit about your background and what brought you into this sort of area of treatment.
Well, my background, actually, I'm from Boston, and I trained at Harvard and UCLA, and I was specialized in preventive anti-aging medicine. And there's places everywhere. Everywhere you look, there's different med spas for women. But if men want to go somewhere, there's no place just for a man to go where he can be comfortable. So we opened up Simply Men's Health Rejuvenation Medical Center, which is a sort of like a man cave den where men can feel comfortable. So you don't have to go with all that foo-foo stuff and at the, plastic surgeon or med spa. So we offer the services for men to help men rejuvenate and restore them to their peak vitality.
Right, and that's also one of these sort of labels that we've been hearing more in recent years when we talk about rejuvenated or rejuvenation medicine. Can you talk a little bit about what that is for people?
Well, medicine has gone through different phases. Before people, it was sickness, prevention. Now we've gone to the point of restoring youth, vitality, and turning back the clock. And that's what we concentrate on at Simply Men's Health Rejuvenation Center. We can turn back the clock for men. We are the ones that introduced, the first ones to introduce the newest revelation, which is the shockwave therapy for ED, which actually can turn back the clock for men. For those men who already have ED, have a little bit of trouble in the bedroom or a lot of trouble, RejuvaWave can restore their sexual vitality. We have 80 to 90% success rate. And for men who are like turning 30, 40, and they're still okay, but they're not like at their peak, if they start RejuvaWave, they will never get ED. That's our goal, is to wipe out ED, just as vaccinations wiped out polio and different types of diseases. We can really eliminate ED with RejuvaWave. If men start early enough, you can do preventive maintenance and always stay at peak performance. That's our ultimate goal. But right now we can help people who, when Viagra is just a Band-Aid and it gives people headaches, and eventually it stops working because it doesn't get at the root cause of the problem. What RejuvaWave does, it addresses the root cause, and it actually reverses and restores vitality in men.
Okay, nice. And now, as a sex therapist, I am just going to sort of have a default position that's a little bit different.
Of course.
That I, would always make a distinction between, or we always make a distinction between what might be psychogenic ED and vasculargenic ED. Right? In other words, a lot of erectile dysfunction, are really psychological and emotional issues. They're contextual. They're relational.
Definitely,
But those
yes.
that are truly organic, they do have that real physical cause, especially if it does have to do with blockages, occlusions, any kind of difficulty with the blood vessels and the blood flow. That seems to be the ideal candidate.
Well, that's what we do at the clinic. That's why every patient has to go through an initial consult. We take anywhere from 2 to 2.5 hours with every patient. We give them individual attention. Every patient sees a doctor. And what we do is, part of our workup is to distinguish whether it's psychological or whether it's a physiological problem. And the two are interrelated, because if you have a physiological problem, you're going to end up with psychological issues. If it starts out as psychological and you're not performing, if you don't use it, you lose it, and you will develop physiological problems. So you cannot separate one from the other.
And absolutely, I think that's a really important point. Because I think for both medical practitioners and therapists, we're often missing the point. And I think the truth is, and the reality is, that if we're not doing both, if we're not covering sort of both angles, we're not really hitting the mark. So the fact that you're kind of doing, and I'm not going to use the word, it's just way too overused, but it's more, I think, complete. I'm not going to use the word holistic. It's come to be something completely different. But when we're looking at this sort of whole person type of approach, that you do evaluate and you do take guys through this pretty much, I think, an evaluation period. And I think that's so really important, because it's also going to be what makes the treatments much more, I think, beneficial. Right? When we really have
Most
a clear
definitely.
idea of who the best and most eligible candidates for the treatments are.
Definitely. And we do, at our clinic, we do address both the mind and the body.
Nice. And I want to also introduce our other guest in the studio tonight, who came with you, Ricardo Guzman. You are also a nurse working in the clinic.
Yes.
And I am just going to throw out there, even if you're not, that you also were a family practitioner,
In
a
Cuba.
physician in Cuba.
Cuba, yes.
All right.
Yes, I was.
So you're coming in with already a lot of sort of background knowledge, just to come in and do the work.
Yeah, that background helped me a lot to understand all the situation, everything that we can do in order to help the patient. And yes, like we said before, we assess physically the patient, and also if he feel mentally, like concerned or something, because he can perform, and be happy and make happy the wife or the girlfriend. So yes, we try to help in both cases, physically and mentally.
Right, and that's also part of that relational aspect of things too. That when you're treating the guy, you're also kind of by default working with the partner,
Yes.
right? Whoever that partner may be. So it really is. There's usually going to be at least two people benefiting from the treatment.
We welcome the partners to come with the patient. Many times, the patient will bring his partner with them.
Also,
we
something
welcome
so
that.
important is once you're treating the patient, you need to be be positive with the patient, because most of the time they want to start something that is new for them. They don't know what to expect about that treatment, and you need to be so realistic and explain everything and be so supportive. So they say, "Hey, you're gonna be fine. Be positive and just try to do your best." Because sometimes
Right.
they don't know what to expect, or they are so anxious to see if they're gonna have any outcome or not. So.
Yeah, and I think that's one of the one of those things that is sort of inherent to a lot of these problems. If a guy is dealing with the reality of having an erection problem, right? Even if it's not diagnosable as erectile dysfunction, it just could be erectile difficulty. There's a lot of shame. There's a lot of sort of negative emotional issues that guys tend to have, because let's face it, we tend to identify according to our penises.
But that's the difference between men and women. Women openly discuss their issues. Whether they're a hairdresser or a spa, you hear that men, they won't say it. They can have the issue and say, not me, not me.
Even to a friend, even to a family, they don't say nothing.
They won't
Right.
admit it.
They don't admit it.
So that is a thing. And that's what we're trying to do, too, is to kind of bring it out more into the open so that men are more comfortable. If men realize that at least 50% of men over the age of 50 suffer from some form of erectile dysfunction, they're not alone. And when they come to the office and they learn that, they're a little bit surprised. It's like if men were able to talk about it and address it, our goal is to eliminate erectile dysfunction. Except for, surgical intervention with prostate cancer or something else. If men address the issue, like women address with microdermabrasion or different facials and we can keep men performing at their peak performance if we start intervene early.
Now, I just want to just put this out there. I just want to ask this question because, again, part of the technology, and when we look at a lot of advancements, and I'll be real honest, I have for a long time been very critical of what has been called anti-aging medicine because, we can't avoid aging, right? So, I guess my question is, and I think this is part of, or imagine it would be part of an evaluation, part of what we would want to look at in somebody coming in for this, realistic expectations, right? In other words, if I am 75 years old, is it a realistic expectation that I am going to perform sexually the way I did in my 20s?
It can be, but we cannot promise that. We have an 80 or 90% success rate. But we have some patients, we have men in their late 70s that say, after our treatment, they could come in here, they had no erections, they haven't been able to have sex. It doesn't happen overnight, but after coming to us 3, 4, 5, 6 months, some of them do say they're having sex several times a night. So we have some men saying, I didn't do that when I was in my 20s. But is that for everybody? No. We cannot make false promises, but we can improve people. We can make them perform at their optimal best for them.
Sure.
We can make it better than they have now. We have so many men that have not been able to have sex. And after going through our treatment, it's like physical therapy. It doesn't happen overnight. We will not make false promises. But if you stick with the program, eventually we have most men, more than 80 to 90%, spontaneously having sex.
Nice.
Some on multiple times a night. More than many, not all, but there have been many patients that have reported that.
Okay. We actually have a caller. I want to definitely get into exactly what the treatments are, but we do have a caller on the line. Larry, you're on the line. Are you there?
Yes.
Hey, thanks for calling in. You have a question?
Yes. Can I ask it? I know Dr. Katz does erectile dysfunction and things of that sort. And what I'd like to know in her center, because there's so many different, alternative therapies for this erectile dysfunction. She does something like there's a Rejuve method versus a Gaines method. Can she kind of exacerbate on that, or tell a little more?
Sure. It's again, that's kind of well, thank you. I really appreciate the call. It's a good thank you, and thank you for the segue. Right? That was the lead-in that I was kind of looking for. So one of the primary treatments that you are referring to is this sort of low-intensity, acoustic or shockwave therapy that they refer to.
Yes.
And the particular one that you all offer is the Rejuve, correct?
Yes.
Right? Can you talk a little bit of what that entails?
Sure. So what that entails is acoustic pressure wave therapy is not new in the United States. It's been used in different aspects of medicine. For example, lithotripsy is breaking up gallstones, kidney stones. That's FDA approved, been used for years. Low intensity acoustic pressure waves is used with orthopedic medicine, musculoskeletal. It's FDA approved for plantar fasciitis. But in Europe, they have been using this technology for almost 20 years. And there's only been maybe 1 or 2 clinics, one in California and Pennsylvania, that have been using it for a little longer than we have. We are the first ones to introduce acoustic pressure wave therapy to South Florida. And we had such experience with our patients, we developed a technique called RejuvaWave. So it uses the acoustic pressure wave, but we have set
Right.
like the gold standard in shockwave therapy for ED. We have closer than a maybe 85% success rate, even 90%.
Okay.
We
so
are pushing
is it like breaking,
with the
is it breaking
RejuvaWave
down?
with improvements. So
Okay. Does it break?
yes.
So we were getting a little feedback from the call. So sorry, Larry. Just we'll continue this answering your question
So
as we go.
basically, we are like kind of the gold standard of shockwave therapy, and we've been doing it now for 5 years, and we've had such great success. There's now a lot of copycats. So it's kind of like flattery that there's a lot of people copying us, but our RejuvaWave technique is different. We've had so many patients. The technique we use and how we apply it is what makes RejuvaWave, and it stands out from other shockwave therapies.
Now, and I know one of the things that this type of procedure, this type of treatment has been used for other things as well. You had mentioned a few, but I know it's also been used to break up blood clots and with
Definitely.
deep vein thrombosis and things like that. So to sort of, briefly and simply describe how this works, I guess it's almost a similar way to the way it does break up blood clots.
Yes, well, how it works in several different ways. In layman terms, I say in one way, it's kind of like a roto-rooter. In the penis, the smallest blood vessels are in the eyes and in the penis. And diabetics are known to have problems with vascular problems with their eyes, eyesight, and also almost every diabetic will end up getting ED. It's a given. And the small vessels in the penis are one of the first ones to get clogged up. It's sort of like a harbinger to problems to come in the future.
Well, that's actually, we've been talking as sex therapists. We for many years have been trying to also point out that erectile difficulties are kind of like that proverbial canary in the coal mine for
Definitely.
cardiovascular disease.
So what the RejuvaWave does, it works in several different ways. I say in layman's terms, it's like a roto-rooter. It's going to clean out the blood vessels because it breaks up the plaque. And in addition to that, it works by causing microtrauma and regeneration. So it is going to regenerate the blood vessels and even the nerves. So it's going to not only improve performance, but with time, it's going to also increase sensitivity.
Now, you used a word that I think needs just a little backup to just bring back up to people, this micro trauma. So that, I think the emphasis for a lot of people have, especially if you're talking about, it's their penis. So a lot of guys don't like to put penis and trauma in the same
together.
sentence. So what we're really talking about are these microscopic breakups of this tissue,
It's
like plaques,
Right,
which forces a
yes.
healing process.
Yes, it's the same principle of any type of rejuvenation process. Many types of rejuvenation process causes some sort of trauma inflammation. Then the cells come in, stem cells comes in, growth factors come in, and you regenerate. It's in cosmetic medicine. Many of the procedures that are done for a woman's face, it's a sort of a trauma and a healing. Have you ever seen a woman after they've had a facial procedure? It looks like a sunburn. Are they
At least.
Are they peel? Well, inside the penis, it's low intensity shockwave therapy, and it works by causing microtrauma regeneration, and we also add stem cells. You don't have to have it, but I say it's kind of like adding fertilizer to a garden. So we often combine it with the pea shot, and we add stem cells to the pea shot. We were one of the first clinics anywhere to add stem cells to the priapus shot. The
Okay.
priapus shot is developed by Dr. Reynolds. We do the priapus shot, but we also add to the PRP, which is from your own body. The priapus shot uses platelet-rich plasma.
Right.
And we add umbilical stem cells and exosomes to that, which enhances the effectiveness, which works in conjunction with the RejuvaWave shockwave therapy and enhances the effectiveness of that as well. They work in conjunction.
And that, particularly that combination treatment, adding on also the use of a penile pump is also what your protocol, I believe, for treating Peyronie's is as well.
No, we do not use
Oh,
a
you don't
penile
use the
pump.
pumps with that?
No.
So for the
With-
combination of the platelet-rich plasma
and the
Rejuva-Wave,
Rejuva-Wave.
that's just for the erectile dysfunction, or do you do that with Peyronie's as well?
Oh, definitely with Peyronie's as well. They're two different conditions completely. The erectile dysfunction most often is a vascular problem. It can also be a neurological problem with the nerves, especially after prostate surgery. A lot of patients who have had prostate surgery, even if they have the sparing prostate surgery, they have nerve damage.
Sure, yeah,
And
there's
we-
really no nerve-sparing prostate
Right.
surgery.
So, but we have so many patients who have had radical prostate surgery performing on their own, no Viagra, no needles. It takes time because it takes time to regenerate nerves. Now, Peyronie's disease is a completely different issue. You can have Peyronie's NED, but you can also have Peyronie's without NED. Many young men can have Peyronie's. Peyronie's is a form of scar tissue in the penis. And eventually the scar constricts and you start to get a curve. It can happen to an injury. Many men can say, yes, I remember some rough sex or
That's
sex
right.
or
Partner
something.
coming up, maybe coming up and then
Right.
out and
But
on, and
they
it's like
can
that
hear-
quote broken penis. We used to call it the bent nail
Or they
penis.
can hear a pop, or they've had some sort of playing sports, or there's many men that have no recollection of any injury, but something happened, and the scar tissue develops, and it can happen shortly after an injury or years after, and when we examine the patient, we can actually feel the scar tissue. Now, Rejuva-Wave will help to break up the scar tissue, and the Priapashot, PRP, platelet-rich plasma, also helps to break up that scar tissue. So what we use for Peyronie's disease, and we've had great success with it, is that we use a combination of the Rejuva-Wave, the PRP, platelet-rich plasma, and we can also add stem cells to that. We use umbilical stem cells.
Now, when we're talking about Peyronie's disease, I also want to make a distinction between what is Peyronie's disease and what is just commonly penile curvature, which we know most men have some kind of
Yes.
curvature on their penis. But we're talking about one that's sort of beyond just sort of the normal curvature a guy may have, especially if it has pain associated with it, with or without the erection. If it makes penetration difficult, then we definitely are looking at Peyronie's, right? But we don't just look at that for just a typical curvature. If a guy has
Well, some men naturally curve slightly.
Yeah.
But when you start to curve with Peyronie's, you will feel during the erect penis, you can
You feel
feel
the
the
adhesion.
scar
Sure.
tissue. And it continues to progress, and it can actually curve as much as a horseshoe and come around if you just let it progress. And it will make penetration difficulty to almost impossible for some men as it progresses.
Right, and that's that proverbial bent nail.
Yes.
That's often been described in the past. So, the protocols that you use for both of those. I mean, there's obviously overlap. There's some sharing, of procedure. Now, from the literature, looking at just sort of something like a Rejuva-Wave and looking at the sort of acoustic wave therapy for something like Peyronie's disease, most of the literature refers to improvements in the pain, but not the curvature. So by you adding the stem cells and the PRP, is that kind of that's where the improvement would come from?
Well, with our patients, we've had success, great success, not with just the discomfort, the pain, because many of our patients don't experience pain, some do. We have actual success with breaking up the scar tissue. So when you break up that scar tissue with Rejuva-Wave, with PRP, with stem cells, then the curvature goes away. So we actually improve the curvature, if not eliminate it completely.
Nice. That's
And nothing is 100% though.
no, of course not. There's no such thing as a one size fits all. There's no such thing as 100%. I've often
And it's not instantaneous. You're not going to have
No,
one.
that's
There's a lot of misinformation where people think acoustic pressure wave. I'm going to have one treatment and I'm going to get an erection or I'm going to get
Right,
a cure.
right.
That doesn't
It's
happen.
not. It's you're regenerating tissue. It takes time to regenerate.
right. So this is, again, another important
Weeks
point
to
that people
months.
have
It
to know.
takes
This
weeks
is
to months.
It's a process. You
a
need to-
procedure which has to take place over time. There would be a number of visits that are involved. Right?
Yes.
So for people that want to find out more and they want to maybe contact you for an evaluation and treatment, especially if things like the Viagra, Cialis, Levitra have not worked for them in the past. Some guys have had the sort of intracavernosal shots and they don't work. How can they get a hold of you?
Well, they can contact us. They can go to our website, www.simplymenshealth.com, or they can contact us. We have an 800 number, 855-511-WAVE, or our local number, 561-459-5356.
Wonderful. So, well, unfortunately, that's our time for tonight. That's what the music means. So thank you so much for coming in. Really
Thank you.
appreciate it.
Thank you.
Thank you all for watching and listening. And please join us next Friday and every Friday night on Sex Talk with the Siegel Brothers. Have a great week.
You've been listening to Sex Talk with the Siegel Brothers. Join us every Monday night at 9 p.m. on WNN, 1470 AM and 95.3 FM. Or watch live streaming video at AMP2 TV Productions on Facebook, or look for the shows on YouTube. Thanks for tuning in, and we hope you'll join us again next week.